occur late, maybe it might be just because of cervical incompetence. It is actually those miscarriages that occur at 5 months and above, 6 months. Sometimes if it happens like that, you can now go and do what we call cervical sacrilege, what we call to tie the mouth of the womb. You can only tie when the miscarriage usually occur from 6 months down. That one is that the miscarriage is caused by cervical incontinence. That's the one we usually tie the mouth of the womb. But for a pregnancy that usually occur at 4 weeks, 5 weeks to 10 weeks, you say next time you want to go and tie the mouth of, even if you tie it and the pregnancy want to go, it will still go. But the one that tying of the womb can actually correct or prevent is the one that usually occur at 5 months, as the case might be. Then there is another thing which people actually overlook. But that one, the miscarriage may never occur close to the time of delivery. So the woman can have a stillbirth, she can actually have a late miscarriage. And that is what we call antiphospholipid syndrome. It's actually a type of autoimmune disease. But how we usually get those people is that somehow you will know. But most times they see it as a or infection. Now, to get it clear, the amount of miscarriage infection occurs quite very small. Once it is at this 8 months, or that person will be pregnant close to the time of delivery, that one is usually caused by what? Antiphospholipid syndrome. And it's a treatable condition. Man, why I hate that one is not because the baby dies. Number one, why I hate it so much is because sometimes it kills when everybody have actually realized that this person is pregnant. If someone have a miscarriage at 2 months, 3 months, sometimes it's only that person and the husband that know. Most of them has not started buying a young one. Nobody know. So they carry their cross alone. But this one of antiphospholipid syndrome, which will allow the baby to get big, sometimes the pain follows the woman even after 2 years. Because if suddenly he doesn't see it again, he will not even ask you how it ended. How is baby? He doesn't know whether the baby is alive. And anytime he asks you how is baby, you remember that there was a trauma. So that is what happens in the case of antiphospholipid. Sometimes stillbirth. But it is not the time that person will just deliver a dead baby and you go home. That is also one of the conditions we follow the person. Sometimes up to 4 months. We will do anchor. You can even do ESR. As common as ESR, you know this patient. If again, why it is important is that apart from miscarriage, it has other sequelae. It can also cause stroke in the young. Antiphospholipid syndrome can cause so many problems because it's an autoimmune disease. In fact, there are some people that come, they didn't come to the hospital because they are having miscarriage. They will come to the hospital because of another complications of antiphospholipid syndrome. When you now start asking them, do you have a baby? They will now say no. That people has been following them now since Kana Chuaria, Yadime, 7 months. Why it is that same thing that was causing that stillbirth, and usually what is actually causing the primary issue